The reason why we're needing to take this action is because we've seen across the sector issues not being resolved. We're seeing the use of insecure contracts being used extensively across the health and care sector. This is in turn, compromising continuity of care. It's causing low morale of staff, and it's not the way we want to see the health service run, and health and care service run in the future. We want to see long-term succession planning which benefits both staff and patients alike.
So what do you mean by insecure contracts, and how does this affect continuity of care?
So you have 0 hours contracts, but obviously where people aren't entitled to any hours, but also we have the use of fixed term contracts, and what we're seeing as well is where people may have a certain amount of hours in their contracts, maybe 40 hours, 20 hours, but they're on a short-term basis. Sometimes they're as short as 3 months. We've even had situations where people are getting monthly renewals and are not even getting their paperwork through, the copies of their own contractual terms coming through. So people are sort of essentially living, in many respects, paycheck to paycheck. And this is not the position, that level of insecurity, that level of fear of not knowing how long your employment's going to be for. It's something we don't think workers in such a important sector as the health and care sector should have to put up with. There's definitely not a clear strategy or a clear rationale in terms of why people would not be renewed or be renewed, and it does seem to be kind of a bit of a kind of cowboy field where it's it's luck of the draw as to whether you could be renewed or not. And this obviously is rightly going to cause a lot of angst within departments, but also across the board. I mean, we've had situations where, and this is more prominent in nursing and amongst carers more than any other part of health and care sector, where we see people not being informed of their termination or their renewal, and simply then suddenly a reason is found out of nowhere for them to be not to be renewed. And people having to live with that insecurity on a day-to-day basis is just simply wrong, and it's not beneficial for the service either.
And finally, have you a set of specific expectations, demands or changes that you want to see happening, or is this more a general expression of discontent at the moment?
No, we do have specific demands. I mean, we have specific departmental issues across the board that have not been resolved. One example that comes to mind within the care agency is a grievance that was signed by over 100 members of staff last year has still not been responded to, and that's just one example. We have issues in the ambulance service which have not been addressed for a number of years. One thing we want to specifically address going forward is we see the new structure coming in. We have not been given enough consultation on how that's going to be implemented, and we want to make sure that, as being the representative voice of the workforce in the health and care sector in Gibraltar, that we are at the forefront of those discussions, and we can actually have our say to make sure we get these issues across the line on behalf of members, but also actually have a better way working forward, where if there is to be a use of short-term contracts, it is done appropriately and it's done fairly, and people are made aware of their contractual terms. We've got examples where people start employment, during employment, and have left employment and have no record of it because they simply haven't been given copies of their contractual paperwork. That needs to end, and that hook or by crook, that needs to end. That's completely wrong.